I'm going to be your student nurse today. How are you doing today?
Doing good.
Okay, I would wash my hands. Can I get your name and date of birth?
Yeah, it's Spencer Anderson, and it's 4/19/95.
Okay, I would assess that the environment is quiet and comfortable, and it is. I would provide for privacy, and I would explain the procedure to the patient. Today I'm going to be doing a head-to-toe assessment on you. And do you know where you are today?
I do.
Do you know what day it is? Can you tell me what day it is?
Thursday.
Okay, and you do know who you are?
Yep, Spencer.
Okay, alright. I'm going to start off with inspecting and palpating your face. Okay, it looks like your face is symmetric bilaterally. The color is even and consistent with genetic background. There's no edema, lesions, involuntary movement. I'm going to inspect for temperature. It is warm and dry. And the only marks are some like freckles, but that is consistent over the whole body. And now I'm going to inspect the lips. It looks like they are symmetric. There are no lesions or masses. They are symmetric bilaterally. They're well moist. Now I'm going to assess your eyes. I'm going to get my pen line out. Okay, it looks like they are equal and round bilaterally. Now I'm going to have you look straight forward for me. I'm going to shine this from the side. There is direct and consensual constriction. Now I'm going to have you focus on a distant object, okay? Look at a distant object. The pupil's dilated. Now I'm going to have you look at my finger. There is they constrict and converge. Now I'm going to assess your hearing. Is it true that you've heard everything that I've said clearly and you have no trouble with hearing?
Right.
Okay. Now I'm going to assess your neck. It looks like it is symmetric bilaterally. There are no lumps or masses. The temperature is consistent with the rest of the body. And the color is even, and the only thing is freckles again, maybe some slight redness, but that's consistent over the whole body. Now I'm going to inspect the trachea. It is midline, and there are no deviations to the side. I'm going to assess the carotid artery on both sides. Regular findings. I would assess for JVD, and I would have the patient lay in a 30 to 45 degree angle. I would adjust the bed and remove the pillow from behind them and have them turn away from the side being examined and assess for jugular venous distension. Now I am going to move to the anterior chest. I am going to assess that it is symmetric bilaterally. The color is even. There's a birthmark, but it's very small. And again, there's just some freckles and slight redness consistent over the whole body. It is. There is a tattoo in the left upper quadrant above the nipple, and it's probably about 5 inches and 5 inches long, 3 inches tall, and it is in good standings. There's no infection or anything with that. The color is consistent with the rest of the body. There's no lumps or masses, and I am going to palpate it. Any tenderness? There's no lumps or masses. Okay, and I would assess the breathing is even, and I would assess the respirations. The breathing is even and unlabored and clear. And now I'm going to listen to it. I would clean my stethoscope, the earpiece, down to the bell and the diaphragm. Breathe in and out each time for me. Okay. Now I'm going to move to the back. I'm going to have you sit on this stool here.
Face faces with.
Like your back is looking. Okay. Now, it looks like the anterior chest is symmetric bilaterally. The color is even. The only marks are some redness consistent with the rest of the body and some freckles. There are no lumps, masses. The temperature is even with the rest of the body, and there's no edema. And I'm going to palpate. Any tenderness in any places. There's no lumps or masses. And I would do the costovertebral angle under the 12th rib. Any tenderness? Tenderness. Okay. Now, I would have done lateral fields whenever I listen to the front, so I'm going to do that now. Turn towards like this way. So, I would clean my stethoscope. Alright. Breathe in and out for me at each spot. Now turn this way. Step this way. In and out for me. Okay, now I'm going to inspect the heart. I'm going to, you're going to have to lay back and I'm going to move this. You're going to have to hold it for me. Okay, alright. Put it on your chest.
Okay.
Hold it like right here.
Okay.
Okay. Alright. So, I would inspect the precordium. Okay, normal findings there. Now I am going to palpate the apex first. I'm going to start at the angle of Louis and hold it like that. Right there. Okay, I'm going to go down to the angle of Louis, go down to the 5th intercostal space, and I'm going to go down to the apex. I'm filling the apex right here. I'm going to go to the left sternal border, which is in the 5th intercostal space as well with the apex. Now I'm going to move up to the base. It's in the 3rd intercostal space. I'm going to fill on both sides. Okay, there is no heave or thrill felt at normal findings there. Now I'm going to clean my stethoscope, the earpiece, and the bell, and I am going to listen to the heart valves. Okay, I'm going to start with the aortic, which is in the 2nd intercostal space. I'm going to listen on both sides. Second intercostal space for the pulmonic valve. Now I'm going to move down to the 3rd for the herbs, 3rd intercostal space. Now I'm going to move down to the tricuspid in the 5th intercostal space. Mitral valve. And then I'm going to auscultate the apical impulse, which is in the 5th intercostal space. I would count the rate and rhythm. Now I'm going to assess for extra heart sounds. I'm going to lay this on your apex again. I'm going to have you lay on your left side. Okay, no extra heart sounds found. And it looks like S1 is louder at the apex, S2 is louder at the base. And I'm going to listen to the bass on both sides of the stethoscope, the diaphragm, and the bell. And now I'm going to go down to the abdomen. Okay. The abdomen belly down this way.
Right, like this.
I would stoop down and look that the abdomen is flat, and now I'm going to inspect the abdomen. It looks like it is symmetric bilaterally. The color is even and consistent with the rest of the body. There's no edema, lumps, masses, and it looks like the temperature is consistent with the rest of the body. And the shape of the ribs the shape is an elliptical. It's downward sloping ribs, and then the costal angle is less than 90 degrees. And now I'm going to palpate all 4 quadrants. I'm gonna have you bend your knees up for me, like this, both knees. I'm gonna palpate all 4 quadrants. Anytime tenderness. No lumps or masses felt. Now I'm going to auscultate all 4 quadrants. I'm going to clean my stethoscope, the earpiece, and the bell and diaphragm. Okay. Left upper sounds present. Right upper sounds present. Right lower sounds present. Left lower sounds present. The sounds are high-pitched gurgling, and I would count that, but it seems like it is within normal range. And then I would do deep palpation, but I'm not going to do that today. I would do it about 5 to 8 centimeters. Now I'm going to move to the upper extremities. I'm going to have you stand up for me. Okay. Now I'm gonna inspect and palpate the shoulder, elbow, wrist, hand, and fingers. All normal findings. It looks like everything is symmetric bilaterally. The color is even. The vascularity is normal. There's no protruding veins. There's no swelling. And there's no edema, lumps, masses. It is symmetric bilaterally, normal findings on both sides. And now I'm going to assess the brachial pulse. Normal 2+ rhythm. I'm going to do the radial pulse. Normal 2+ rhythm. Now I'm going to have you flex your arm for me. Extend it. Now push up, push back. Okay. Now I'm going to test pronation and supination. Go like this, this. Okay. Now I am going to assess your fingernails. It looks like they are round in shape. There's no clubbing or brittleness, and the capillary refill is under 2 seconds. Normal findings. Okay, now I'm going to do your lower extremities. I'm going to do your hip first, and your knee. I don't know if this can see that. Okay. Now I'm going to sit down now. Okay. Now I'm gonna feel of the feet and the nails. There's no clubbing, no evidence of brittleness. They are round in shape. Now I'm going to assess the posterior tibial pulse. It's a normal 2+ rhythm. And now I'm going to assess the dorsalis pedis pulse. Normal 2+ rhythm. Now I'm going to have you flex your foot. I'm going to have you point your foot down, which is plantar flexion. Point it up, which is dorsiflexion. Okay, now push down. Push up. I'm going to have you stand up for me. Turn to the side. Put your leg up. And push down. Okay, all normal findings. Now I am going to assess your hand grip. You can sit down for me. Yeah. Okay, it is a firm grip. Now throughout the whole exam, I assessed his level of consciousness as alert and oriented, and O times 4. The appearance and behavior is appropriate to the situation, and the speech was clear and articulate. Thank you for your time today. You can get comfortable in your bed now, and I'm going to put your bedside table within reach, your call light up, your bed in lowest position, and then I would wash my hands.